Welcome to the Leisure Management and Leisure and Aging webinar series, Building Community through leisure programs and services for older adults, a management perspective. This is a new initiative for the Leisure Management and Leisure and Aging SIGs because we've not collaborated on something like this before. So it's great to be able to broaden our horizons and tap into two of World Leisure Organization's special interest groups. These webinars are one of the things that we do within the special interest group activities to try and bring information into people that will help them to, in their research, in their program delivery, in students learning, or however else we might do it. You should also note that the webinar is being recorded and will be available in several weeks once the recording's edited and things like that. So we'll go from there. So I'll stop the screen share and try and introduce some of the main people that are with us today. So Maya is up very late in Bilbao and is the technical whiz behind what we're doing at the moment. So thank you for keeping us on the go. And I think she's going to put a message up on the chat about how you might want to change your name if you're sort of wondering why has my name become Maya in the Zoom session. We also want to welcome Joanne Zimmerman, who is the Associate Professor at Texas State University and co-chair of the Leisure Management Special Interest Group.
Hello,
Doug
everybody.
Kleber is the Professor Emeritus at Georgia University and is also a co-chair of the Leisure and Aging Special Interest Group. And Darla Fortune is the Associate Professor at Concordia University and co-chair of the Leisure and Aging Special Interest Group. And Antonio Bramante is a World Leisure Board member and also a keen collaborator with a lot of our initiatives. So welcome to that team. And we also have three special guests today. We have Toni Liechty, who's with the University of Illinois. We have Margaret Donnelly, who works with the, it's a mouthful, Senior Compliance Officer from Aged Care Quality and Safety Commission in Brisbane, Australia. And Janell Payne is Director of Recreation in the City of Jordan in Utah, USA. So we've got a great team with us today. So we'll go from there. And for those that don't know me, I am John Tower. I'm also co-chair of the Leisure Management Special Interest Group and an honorary research fellow at Victoria University in Melbourne. Before we go any further, it's a tradition in Australia to pay respect to the traditional owners of the land. I respectfully acknowledge the traditional owners of this land. I'm on Wurundjeri land in the Kulin Nation. I value the culture, relationships to country, kinship connections, and journeys of the first peoples of this land. I pay respect to the traditional elders, past, present, and emerging. Always was, always will be Aboriginal land. So we have the chat function in operation if you want to share comments or questions, and the team of collaborators from the two special interest groups will help us manage the chat. We also ask that you use the chat just to provide a short introduction so everyone knows who's participating in the webinar. I'm pleased to note that you're amongst over 120 people that registered for this webinar. I know that many of those people won't actually be in the room because time zones are like that. So they're not always able to do it, but we'll go with what we've got. And it looks like we've got a really great participant number. There's over 40 of you in the room at the moment. So the format today is a bit of a conversation amongst our guests, and we'll follow that with your comments and questions. And I'd like to welcome Toni, Margaret, and Janell. So the aim of the webinar today is to raise awareness of leisure management strategies to deliver leisure experience for older people in community settings. So I'm going to start with Toni. She's an associate professor at the University of Illinois, and asked that you provide some of your insights about the principles to guide leisure programs for older adults. And I will try and get the share screen going again for you, Toni.
If you ask people who are not speaking to turn off their microphones, there's a bit of a feedback, at least what I'm hearing.
Okay, I think you just asked them, Joanne. Oh, thank you.
Thank you.
All right, Toni, tell us a little bit about the research that you know that can guide some of our program delivery options.
Yeah, so first, I don't necessarily want to speak for all the research out there, because there's a lot of great researchers doing research on leisure and aging. Some of them are here with us today. So, but some of the research that I've done has looked at program-specific feedback. So what do people like about the specific programs that they do or don't like or whatever? And also looking at organizations or facilities and what people like or don't like about those. And also looking at how older adults look at leisure within the context of their lives. So for example, I'm still finishing some data collection on a longitudinal blogging project where we had older adults start blogging actually at the end of 2019, and they're going to finish up at the end of this year. So we're understanding what their life is like and how leisure fits into that. So some of the things that we've learned are, for example, people want routine, especially once they've retired. They've lost the routine of their work day, and leisure helps to provide that. A lot of people say that they're looking for friendships and social support, especially with other older adults, because they're in the same life stage, and leisure provides a space for that. People have talked a lot about sort of having a welcoming impression the first time they go to a leisure experience or to a leisure program or to a leisure facility. People talk about wanting multiple benefits from the same activity. Like, for example, some people say, well, if I just have to go to the gym and I'm going to get some exercise, that's great. But if I'm going to go for a walk in the park with my friends, I get exercise, I get sunshine, I get social engagement. So I guess some of the takeaways are just that older adults are looking for leisure programs, and they have a lot of different experiences, but those are often different at this life stage. That was like a summary of a lot of stuff into a short period of time.
Yeah, and that's what we do with these webinars. It's just a sampler of some of the things that people may need to be aware of. So when we talk about some of those things, what are some of the things that people are trying to, from your experience, are putting into practice?
I mean, these are just a couple of examples of putting some of our research into practice, some of the research that I've been working on. That project I mentioned about the older adults blogging group, I'm working on that with Dr. Rebecca Janell, who's in Canada. And we actually created a program that we ran through the Lifelong Learning Center there in their local community. And a lot of older adults were very enthusiastic about this program. And a lot of them said that the reason that they signed up for this course was because when they were planning for retirement, they planned for finances, they planned for their health, they planned for housing, but they didn't plan for what to do with all their free time. And so they joined this class to learn just basically what are the resources for leisure in their community, what are some ways to sort of, actually a lot of them said they just wanted opportunities to make friends, because that's not something they had a lot of spaces for when they were used to having that in their workplace. It was super popular, and now we're actually working on developing kind of a self-guided type of program that people could do online. We also work a lot with professional organizations that we collaborate with in our research, and we provide reports to them on how they could make other programs more inclusive or more meeting the needs of older adults. And one of the programs that I worked on with a local community organization was looking at how to make their facilities more inclusive and more attractive for older adults. And one of the things that they said was, or one of the things we learned was that the staff in their facility didn't feel really well prepared to accommodate if people had different kinds of disabilities or different kinds of chronic conditions. And so we put together a staff training program that they found really helpful to just help them be more inclusive in general.
Okay, so there are people that are actually, and you're working with groups that are taking the research and then putting it into practice, which is great. Margaret, if I could turn to you now, you spent a lot of time in your career working in aged care, and you're now with the Aged Care Quality and Safety Commission. Can you just tell us a little bit about that role to sort of set some context for us?
Okay, so that role came out of a royal commission that was done in Australia for the safety and quality for aged care services within Australia. And the things that they're looking at is the standard of care, the clinical standards, the evidence-based healthcare, and also providing those resources and the supports to the services to ensure that safety. So as the compliance officer, that's what I do. I work with the services to make sure that they are compliant and they are providing a safe environment. I suppose, though, as you said, a lot of my experience is being a provider. So I draw a lot of my experience on my time at Myrtle Cottage, which is a centre-based service. It provided group activities and individual activities, respite, transport, and meals. And I suppose it leads on very much from what Toni's just said. Some of those, the barriers for providing the community leisure programs is about funding, and what Toni was just saying about the staff training. I think that's one of the really big important points, is when you to look for funding, to make sure that you do have the resources to train staff to be able to run a creative, meaningful activity. Some of those research trials have also led to programs like social support individual and the social support group. The other things is about facilities. So the standard of accessibility into the facilities. So you'll see in a minute, there'll be some photos of different activities. So when you're looking at those facilities, what are the things that you can do that, like you can see there's some that are actually in a centre, but there's also the gentleman that's golfing, which is, if you look at those things, he can then go and participate in that. He will then go and do that with his family and friends, and you've extended that social leisure activity to more than just the program. The other thing that I find is about the lack of knowledge. So older people and their families and friends don't see the benefits of the leisure activities and all the things that Toni's just said about that social connection and all of that sort of stuff until it's a little bit too late. So it's about promoting those programs and using stories. Like, as you can see there's the bus with the Australia Day. So going out and participating in local community events, and it may
Uh-oh, I seem to have lost you, Margaret. We can no longer hear you.
Promoting,
there you
look
are.
at those. Oh, I can hear.
Okay.
You right?
Yep.
Is my internet unstable?
No, you're fine again. Go for it.
Okay. So some of the challenges for providing the older programs is promoting the benefits that in so now I've lost it now because of that. Hang on, give me a sec. Yeah, so to promote those skills that people, as Toni was saying, so now I'm back on track. Like Toni was saying about routine. So just having somewhere to go throughout the day, making sure that people are eating so they don't get sick, that they're moving around so they don't end up having falls. The purpose of just having a process, or like somewhere to go, is good for well-being as well. And I suppose then the other thing for some of the barriers is about knowing your demographics. So when you do provide a program, what's in the area? What's your target group? What's the area made up of? If you're providing for an area with low socioeconomics, it might be that you can promote a sausage sizzle, but get male staff and male volunteers involved. if you're promoting to a higher proportion of women in the area that have limited education, look at craft fairs and craft activities, trying to make it very specific to the organisation. And whenever you promote all those activities that you've actually done that are especially within the community that show that access, and link it to activities that are there at the time. So what are the interest groups? What's your cohort? What's your age group?
Okay, well, thank you for that. Now, Janell, one of the things that we wanted to talk about was the, let me just stop sharing here and we'll get people back on screen. So we talk about the policy context, how, and Janell is in Jordan, Utah, so a suburb near Salt Lake City, but not quite there. Can you just tell us a little bit about the public policy impacts on older adult community programs? How do you get the policy right?
Yeah, definitely. I feel like policy, this is a huge question, obviously very important. I think the biggest impact it has on delivering any kind of program, whether it be to older adults or in my department in general, is the allocation of resources. So setting up the expectations there and the plan.
Being used today.
Someone, there you go, muted. Thank you. And one of the things that we're doing, or we've set policy in our elected officials, and for context, like John said, I'm with the City of South Jordan municipal government, and what our city has taken as far as policy in allocating resources is a strategic approach and priority-based budgeting. So we have strategic priorities throughout our whole city, such as like reliable public infrastructure, an engaged community, a safe community. And so it's not just like the fire department and their things, or the recreation leisure department and their things. Everything that we do as a city and in our structure is tied to multiple points in those strategic priorities. And so that policy kind of has set a stage for us to go in and represent ourselves. Obviously, having data, both quantitative and qualitative, is huge in this. So we can go in and rate, okay, we have this program, whether it be in the arts, and again, that it's not in its silo. We have arts that our active adults participate in. Is it touching multiple priorities that our city council and our residents have provided input in? And then the higher it ranks, the more I guess we have, or some justification to allocate those resources of time and funding. So that's in a nutshell kind of how we've approached it, and we really tried to get it right and have representation and a seat at the table as policies created and those resources are allocated.
Do you ever get pushback from some of your colleagues in other areas to say, well, look, that's not our responsibility? And if so, how do you deal with that?
It depends. And I think most of the time through the process of evaluation, the things that we would get pushback on, sometimes they're hard truths to see, like, yeah, this is not an effective use. It's a great program. We had a marathon that people loved it. We did it really well, but ultimately it wasn't serving the community to the level that we needed for our investment. And so we cut it. So the pushback, I would say the approach and the policy that we've implemented has eliminated that kind of butting heads between the departments. We have good collaboration, but it's pretty evident as you go through your programs as a director or program coordinator, you can see what's making the cut and what's not.
And you explain those sorts of guidelines. How much does a municipality like you and your colleagues in other municipalities, how much engagement is there with research to inform some of the initiatives that you take?
It's a great question. We have a lot of internal research. We do an annual city survey. We have different, depending on the interest, or if we're doing like a master plan, we did an arts master plan recently, we'll have specific research in that area and statistically valid random surveys. We have not utilized as much of the resources that's out there. I've learned recently with some of our local universities And like Utah State, for example, has done a great job of getting some research within recreation and older adult services included that I was just made aware of within the last year. And that's a goal to kind of look at that and implement it and do better at forecasting and seeing what's coming too. Again, with the caveat of, there's differences in communities throughout our area. There's a wide variety of demographics and, needs, but yeah, that's something we're definitely seeing a benefit that we need to do better on.
Okay, thanks for that. So I want to open it up just to Janell, Margaret, and Toni now. If you got any comments or questions for each other to sort of pick up on any of the points that any of you have raised.
I mean, I just kind of resonated with what they were saying. And, to Janell's point, I think that is a good, it can be tricky to sort of convince your elected leaders or your city officials of why leisure matters. And I think especially for older adults who don't tend to be well represented in certain spaces. And especially, older adults, we talk about it like it's all the same group, but it's a very diverse group within. So, some segments of the population may not be very well represented. So, obviously I'm the research nerd of the group, so I'm definitely going to, recommend using research as a good way to sort of justify the value of some of the programs. One of my colleagues in our department actually did a study looking at how having more parks and recreation facilities and programs for older adults lowers public health costs for different regions. And that could be a really good way if people don't care, just about the well-being of older adults, they might care about cutting costs for their own budget. So, yeah.
Okay.
One thing I failed to mention, John, too, in getting some local research, and Toni reminded me of it, is just having an engaged community of your older adults to what's the word I'm looking for? Advocate on their own behalfs. We have an adopted senior advisory committee. So each council district in our city, there's a representative, and they can appoint 2 members to this committee, and then they advise staff and then also the council on things going on in the area, what they'd like to see, what's being received well, and then they're involved too, because we can ask, but they have their network of friends and community members and neighbors that might not be as comfortable talking to me or a city council member, that they can then have that representation and trust of the council as well. So that's been really beneficial for us.
Okay. I want to pick up on something that Toni mentioned at the beginning, and I might actually ask Joanne to comment on this. And the reason for that is, she mentioned the important role of leadership. And one of the things that people want when they join a program is establishing friendship. And I haven't done a lot of work in the older adults area, but I have done a lot of work in programming in leisure centers, aquatic centers, and those sorts of things. And one of the things that strikes me is that people identify that wanting to make friends, but the leaders don't necessarily get trained up to how to do that. How do they get their people in their classes or their programs to engage with each other? Joanne, can you comment on anything about that whole role of leadership and how we manage and deliver these sorts of programs?
Well, it's interesting. I actually was just talking to one of my classes that I teach about this very thing, and recognizing that, yeah, people don't necessarily know how to get everybody engaged and feel welcome. And that I figured out one year when I just assumed that everybody knew how to say hello and welcome and introduce, and found out that wasn't the case. And actually in my staff training, had to initiate, okay, this is how you introduce yourself. This is how you welcome people in. Let's do some get to know you activities. We're going to model some in our training that then you can use in your programs. And I think they can be used for any age. We do them at our university classrooms. We do them in programs that we do out in the community. Margaret, do you guys do anything like that to get, when you were at Myrtle Cottage, all those people seem to know each other very well from my experience.
Yeah, look, and I think that's what I was talking about when I was mentioning about the funding. It is so important that you've got the money and the resources to provide that training so that staff do know how to lead a group, welcome the clients in, promote your service, all of those sorts of things, because people don't, if that first impression is not welcoming and not engaging, you've lost them right at the start. You need to be able to show that you can welcome somebody in, that you're interested in what they're doing, and that you can provide them those activities. All of that takes a leader. And then you also need to, like, we've got volunteers that we've trained volunteers, and we provide small support groups for them, how to, exactly what you said, how to start a conversation, but also how to end a conversation. So you're not leaving somebody feeling like, oh, that wasn't quite finished. Because that feeling, and especially if somebody's got dementia, it's that feeling that will make them come back or not. If they don't feel safe, they won't come back. And that's not good for them either.
I have a good example just to go along with that. We did the study of a aerobic dance program that people do in the local community. And it's very unusual because people have been going for 30 or 40 years to the same program every week. And we wanted to find out why they've had such good attendance, especially with an exercise program. People don't tend to keep going all the time. And a lot of them said, the first day that I went, I was very nervous. And the instructor introduced me to someone who'd been in the class for a long time, so that I had sort of a buddy. And then that buddy showed me where the equipment was and where to get water and all of that. And then I became the buddy for the new person. And they said it was not the activity itself, it was the social relationships that kept them coming back. And one of the things that a lot of them said was, if I didn't come back, I knew that somebody would miss me. And they would reach out and say, hey, you weren't at class last week. And that was more important than any of the other factors for them to keep coming back.
And that actually goes on to the activities. So that's like an aqua group, but in a centre-based service, you might provide, they've just done Halloween. Not everybody celebrates Halloween, but it's just that you've got somebody that goes, oh, you like Halloween, tell me about it. Mm-hmm. It's that connection straight away. Yeah.
So it sounds to me like one of the key things is, these programs need to be building that social connection, building relationships. That's what gets people to stick in with it. Is there, Janell, I'm going to come back to you because you're the one that we're drawing in on the policy. How do you build that sort of thing into a policy framework? Do you think you can, is there some way of structuring it so that people understand that this is what we're trying to achieve?
I think I've done master plans a lot recently. We're updating our recreation master plan. I think the biggest thing, you're not going to say like, we're going to welcome everyone this way in that level of policy per se. But I think just removing the roadblocks in your policies that might prevent that would be huge. So internal policies and department policies, would be more, I think, applicable in this case, or your facility, and creating the spaces. Even as we're personally in South Jordan looking, we've proposed a new senior center, specific, so a recreation center for our seniors. They're just growing so quickly, and it's been a long time coming. They're in a shared use space, and we're doing kind of a strategic partnership with a philanthropic arm of a development company here, and using some RDA funds creatively to do some affordable senior housing in the same area and walkable to the senior center. But having things like that in mind, and as we go through and design the facility and the concept, making sure there is space for the informal gathering as well as the formal classes, and really designing that facility to its uses and multiple uses, but just as smartly and efficiently as we can. Sorry, that was a little bit of a tangent off with that project, but I thought it was important to mention. It's really unique and something that we're looking forward to as well.
And that's what we want. We want some of those practicalities so people can walk away and say, oh, well, yeah, we can do something like that as well. So spot on. Thank you, Janell. Well, I was thinking that we've got over 40 people in the in the webinar at the moment. I'm not sure if any of you asked any questions yet, but thought we'd find out if there's anything from anyone in the webinar, any issues you want to raise, any comments or questions. And Joanne, you look like you're ready to share something.
There was a hand raised. Anna Thumb. I'm not sure if I'm saying your name right, but you had your hand raised. Did you have a question or comment?
Well, it's not a question, but when I listen to what you're sharing, so right now I'm during my internship. So I have another over 300 hours to in the nursing home. So I'm passionate with the aging population, and I have worked in the nursing home for 5 years before I decided to take a degree from Western Sydney Uni. And I applied all what I learned. I used the intergeneration learning process to empower residents who are really like know Southeastern and who taught me in Spanish, improving. And what you mentioned about how about social relationship so important, and I applied in the therapeutic relationship. That is, if I can build up, do just to other residents so they can trust in me. So before, when I arrived, I saw the exercise class only not many people. But when I try to find out why not many people coming, because they have no idea what it's for. Just come, but I do not leisure education to empower residents. Why you need to go here and whatever there. So I also connect everybody together. So they feel a kind of at 9 a.m. I come out because they're my friends who's waiting for me, and they feel a sense of peaceful belonging community. And when the physiotherapist was not available for the exercise, I conduct exercise because my background is the physiotherapist. So I do that, and whenever I go, they all come out full house. And I found that, like one of you mentioned, that how can we create a safety environment, and when they feel a kind of sense belonging, I want to come again and again. So if they are not turned up, I will go ask, how are you? Are you okay? So always asking, make sure that they are all special in my heart. And everybody want a hug from me in the morning. So it's really impressive. So I think that's so important. What you just mentioned, what you have been research. I haven't do any researching, but I just apply what I learned from the uni and put into practice. And that is what I would like to share to you. Thank you.
That's excellent. Thank you. Doug or Darla, go ahead, Joanne.
I was just going to say, I don't see any other questions. Lots of people introduce themselves, which is wonderful. But we've got people from all over the world here. So I would encourage more people to raise up their hands.
Well, I've got some questions that I would like to explore with our guests. And as people who may know me, I'm a big advocate for stakeholder engagement in terms of how we plan and deliver community leisure programs. Could you provide some comments about the importance of stakeholder engagement, who some of those stakeholders are, and how do you get them to engage? And I think that Anna just talked a little bit about that at a very micro level within a nursing home, but just some comments about stakeholder engagement, please. How about it, Margaret? What are some of the?
I was just about to say, did Janell want to go first?
College. Sorry?
I said, did Janell want to go first?
Okay, you go ahead.
I'll go ahead. Okay, so what I've sort of got about stakeholder engagement is a bit of a story. So I'll tell you this story. And it just, for me, stakeholders is the clients, the carers, the other services that you work with, and you need to be able to all work together. So this particular, I'm going to use the name Val because Val is a very common name. So this particular client, she was overweight, she was sitting at home, she's watching TV. Her family was becoming frustrated with her with the lack of communication. Eventually Val had a fall. Lucky she didn't hurt herself. Though due to her weight was unable to get up, so an ambulance was called and took her to the hospital for observations. And just a point on this, it was actually her neighbours that found that she fell. The hospital referred her to a social group for social and leisure activities. Val attended spasmodically, though while in the program, her profile, so this is probably going back to something that Anna was saying, Myrtle Cottage creates profiles, so it's not just about their clinical information, but also where did they grow up, what do they like, what's, do they have pets, all of those sorts of things. So while her profile was building up, we sort of got a bit of an understanding of what Val was interested in. She ended up in hospital again, and this time it wasn't a really good prognosis. It looked like that was it. She was just going to a nursing home, but we worked with the hospital. So while she was still in hospital, we were providing activities for Val to do to start becoming engaged again. So reading, we would send off craft activities. She used to love the, there's a thing that you put sparkles on like a colour number thing. She used to love those sorts of things. And we also then connected her on a link line. So it was, basically people get rung up that are either at home or in hospital or whatever, and there's a phone conversation. So over that, throughout that gave her the motivation. She lost weight. She came back to the centre. She started participating in other games, like there was balloon tennis, played gin rummy. So now she's got brain activity going. She's got physical activity going. And she was able to then live out her life around her friends and her family, where she eventually, when she did pass away, she was passing away on her own terms in her own home. So that just goes to show how all those connections work together. Otherwise, she would have been in a residential care for about 10 years.
Okay. And Janell, you've got you mentioned earlier an older adults advisory committee or something like that in South Jordan. How does that work, and how does that act as a function for that wider stakeholder engagement?
Yeah, they are a group. They can have up to 12 members. They're appointed by the city council members and mayor, so 2 from each district and then 2 from the mayor. They meet monthly at our center. We have a staff liaison, which is our center manager, and she's fantastic. Her and her staff, some of those examples of more of the micro engagement, and that is exactly what they do as well. So they do their monthly meetings. They have a separate budget from the center operations. It's modest, but they will sponsor activities throughout the community. Their primary focus is to advise on the programs and offerings that we facilitate, but then also to encourage participation. So again, I think I mentioned just having that community member or common ground, not as intimidating or not a faceless email kind of post. It's someone specifically reaching out to those in their networks throughout all areas of the city and encouraging participation and getting feedback, and that has been really good. We've also, I wanted to mention, not just our city, but a neighboring city that runs a center. When they offer programs or they get requests for programs from different stakeholders, they'll often ask like, oh, well, if you're interested, do you know anyone who would teach? Or are you interested in teaching? And that often encourages the participant to develop either a new or kind of an intro skill so that they can teach others. And again, it is very much more widely accepted initially because it's coming from someone of their similar background and just easier to relate to them. It's someone they know or they are familiar with in the community. And that's really helped us as well get that engagement too.
Excellent. Okay. Well, listen, we're running towards the end of the session. Toni, I'd like to draw you in just for a final comment about some of the things that we've talked about today and how it relates with your research and some of the programs and activities that you see going on in the community older adults programs.
Just sort of my overall takeaway kind of thing.
Yeah.
I would say just some of the things to sort of keep in mind is, as we've heard, sometimes the people who might benefit a lot from your programs are not the people reaching out to you and saying, hey, here's what I want. You know, sometimes they're sitting at home waiting until their neighbor calls and says, hey, this person needs help. Or sometimes they just don't feel sort of entitled to speak up. And so making an effort to kind of reach out to all the different types of older adults in your community can be really beneficial. And Janell mentioned maybe getting some local research from a local university. That can be a great way to get some, do some surveys or focus groups with your local community. And I guess the other thing I would just say is sometimes if you do have people who really want to be engaged, getting them engaged in kind of like Janell was saying, the promotion and the design and the ideas behind it, it can add more buy-in, because then people feel like, oh, this idea came from another person in my age group. They understand me. And one of the challenges, you know, I do a lot of research with retirees specifically, and almost by definition, they do not exist in the staff of our community organizations. So it's harder to get representation and understanding of where they're coming from. So I think just getting their input and, you know, listening to what they have to say and getting them involved in the process can be really valuable.
Excellent. Thank you. Joanne, are there any other comments or questions?
There are not any that I've seen in the chat, but I wanted to ask Margaret a question. I recall when we were first discussing this opportunity that we were talking about Myrtle Cottage, and I was lucky enough that I took a group of students on study abroad, and we visited. That's where I met Margaret, is we took students to Myrtle Cottage, and also we had so many students that she handed us out to other programs around the community. And one of the things I remember her mentioning to me is that some of them are culturally based and some of them are activity based. Am I getting that right? So that people can have different types of experiences through the week?
Yes, not necessarily activity based, but yes, definitely culturally based. So with those students coming over, the groups are usually smaller groups. They're not like, you're not looking at a big school or anything like that. There's 30 people in a group. So when you have students come in, there's limited places for them to be. So what I'd done is I'd linked in with a cultural group that had I think it was the multicultural group, but there was also a Spanish group. There's also there was ones for different areas. There's one for younger people with disabilities. There's ones for people with dementia. So for somebody where we linked very well with the cultural group, if we had somebody that came in that has English as their second language, there's Spanish, they can actually attend the Spanish group and also Myrtle Cottage. So then they're still using their English skills, their English knowledge, and then they're also connecting with their cultural groups. Yeah.
Yeah, that's what I was trying to get at. I knew there was a connection to where they could have different types of experiences. And I think that's a great way to build community, because it's about meeting new people, but it's also about being people who are similar. And I think the combination of the two builds great social capital across the community.
That's right. And you don't want to lose those connections. That's who makes you who you are. That's why those profiles are so important, to know all those background issues. And then like as to the disability groups and the dementia group, that's where you really need your staff training. So you need that, like dementia, you could have Montessori training. That's where that training comes in. But you still got to remember that person is a person first. And what are their cultures? What do they know? What is familiar to them? What's going to make them feel that they're valued and part of the community?
Okay, well, we target about a 45-minute webinar, and we've hit that milestone. So I'm going to go back to share some of the information about some of the resources that you might want to tap into. So we've got an email address for Toni. Margaret and Janell both provided us with some web links to tap into. These will be available via the video of the webinar in a couple of weeks. And if you're really desperate, you can either contact one of them, or you can contact me, and or Joanne or Doug or Darla or World Leisure. So we've got a whole range of resources for you that you can tap into. And thank you to everybody. Special thanks to Maya in the World Leisure Secretariat for helping us get the infrastructure and staying up late to be part of the webinar. I appreciate the support and guidance from Joanne, Bramante, Darla, and Doug, who are part of the team to deliver this particular webinar. It was great to have another SIG to collaborate with, and hopefully that's worked well from everybody's point of view. And extra special thanks to Toni, Margaret, and Janell for being willing to share your insights and knowledge about community older adult leisure programs. It's great to have leisure colleagues who are willing to contribute your expertise to help meet World Leisure's mission to share leisure's capacity as a central force to enhance human conditions. And we know that there's lots of challenges in every aspect of the community, but if something that we said or they shared today can help others deliver better older adult community programs, then that would be a great outcome. So thank you for everybody for joining, and look forward to seeing those of you that are coming to the World Leisure Congress in Dunedin. I know Joanne and I and Doug will be there. Maya will be there. So it'd be great to see you in New Zealand. And if not, then we'll keep you posted through our various communications from our special interest groups to keep you informed of some of the things that are going on that relate to your interests in leisure provision. So thank you, everybody. That's all we've got for today. And the video will be available in a few weeks. The fact that you've registered means that we've got your contact details, and we'll automatically send you the link once it's ready for you to have a look at. All right. Thank you, everybody. That's it for today.